Hi everyone, I'm Stephanie with Nine Health. Today we're focusing on how the pandemic has changed our lives, from weight gain to relationships. I put in the description, some people are calling it the quarantine 15, the COVID-19. We're going to talk about how it's changed our lives in a bunch of different ways. I'm joined via Zoom by Jason Youngblood from Cigna. He's a licensed professional counselor, and also Nine Health expert, Dr. Powell Coley, who's a cardiologist, but also an expert in internal medicine and preventive medicine. Nine Health has partnered with Cigna to help build out our free online mental health screenings. You'll find those at ninehealthfair.org. I'll put the link to those in the comments because they are a great resource to just check in on your mental health, which again is probably in part, due to some of the life changes we're experiencing and weight gain maybe. So we're going to just talk about all of it, address all of it. First, Dr. Coley, some have called it, again, the quarantine 15, quarantine 19. If you've gained weight during the pandemic, you're probably not alone. So what can people do about it now?
So you're absolutely right. In fact, studies have shown from Weight Watchers survey that the average weight gain for the average American has been about 12.5 pounds. So the COVID 12.5 is what we should be calling it. And it's also interesting that women appear to have gained weight more commonly than men. And so there does appear to be a little bit of a gender difference in terms of what's sedentary. But if you've gained weight, the first and most important thing is to admit that to yourself so that you can then take steps to reverse that process. Because when you do gain weight, it causes a lot of metabolic abnormalities. It can change a lot of different things in your body, including your metabolism, your cholesterol, your blood pressure, your blood sugar, and all of those can have downstream effects and accelerate the onset of disease. So if you've gained weight, that you need to admit it. You need to make a plan to lose weight, and that involves, more activity, obviously portion control. And then you need to make sure that the impact of the weight gain has not had some significant impact on your medical health. And the best way to do that is to really get a snapshot of your health doing screening blood tests, such as the ones offered by Nine Health that can help you understand what the impact of that weight gain has been.
Yeah, Dr. Coley mentioned it. We just started offering the preventive screenings that you can normally get at a Nine Health Fair. Those were canceled in the spring. But you can now go to Quest Diagnostics patient service centers and get those. You can go to ninehealthfair.org and sign up. Again, get your baseline of health, because if you've gained some weight, maybe some things have changed inside of you and you should probably try to figure that out. But there's also kind of a mental health aspect maybe to all of it too. So I wanted to bring in Jason Youngblood, again, as a licensed counselor with Cigna. The pandemic affecting our mental well-being in a bunch of different ways translates to our physical health. Weight gain is just one of those examples. Talk a little bit about how the pandemic has led to weight gain.
Sure. I mean, there's definitely that connection between mind and body, Stephanie. Specifically when we're under stress, either like extreme acute stress or longer term chronic stress, our body releases a stress hormone, cortisol, and cortisol can be associated with weight gain. If your body feels that it's in danger of not having what it's needing down the road because of stress, it could actually cause you to store and hold on to things a little bit more. So not uncommon for people under stress for a long period of time to gain some weight. I think the second thing to think about is how we utilize food. A lot of us utilize food because it makes us feel better. We tend to eat richer, more high calorie foods. And I myself have been guilty. And in my own household, there's been never ending brownies for dessert, which typically is not the case. And I think the third thing to think about is drinking. There was a recent poll that looked at people who are working at home and found that 40% of them start drinking actually during business hours. And if you think about, you've got your chronic stress, you're storing things a little bit more, you're eating a little bit differently, and then you add in a lot of additional calories from alcohol. It's no wonder that we're 12.5 pounds up.
And I want to piggyback off of something that Jason said, which is that when we release cortisol from stress and gain weight, it's the worst kind of weight to gain, actually, because it goes right on our tummies. And that's a phenomenon called central adiposity, where weight on our tummies, where we become more pear-shaped, is worse than weight all over, which would make us more apple-shaped. So that's the other thing in terms of cardiovascular risk, is that type of weight gain is the worst kind that we can have.
And someone just commented, I've lost 10 pounds. Jessica, good for you. That's great. As long as it's a healthy 10 pounds and you're not, again, there could be mental health aspects to losing a bunch of weight too, instead of just gaining weight, right, Jason?
Yeah, absolutely. I mean, sometimes people under very extreme stress can not eat as much. And so people either tend to gain weight, which I think is a little bit more common, or people lose weight. And I've connected with a lot of people who've made their physical health a focus right now during the pandemic. And I think there's a certain percentage of people that really have focused on their health and well-being and maybe have lost the COVID 12.5 and plus during the time.
Yeah, Christina just said she lost 13 pounds, so just a little bit over that quarantine COVID 12 and a half. I put quarantine
Yeah.
15 COVID 19 in the post, but as Dr. Coley said, we've been averaging a 12 and a half pound weight gain with
And I was just going to say, to Jason's point and the point you're making, Stephanie, is that some people lose weight because their caloric needs go down because they're less sedentary. So, you know, our hunger, our appetite, all of that is driven a little bit by how much we're burning off as well. So we're walking around, getting outside, going to work. Those are all calories that we need to then replace with food intake. But for some people, as Jason said, the minority usually, because most people gain weight when they're sedentary. For some people, they have a shift in their appetite, in their hunger, in many of those metabolic activities that would, you know, induce them to eat. And so they end up eating less, not necessarily because of stress, but possibly because of physiologic reasons.
Yeah, and maybe at this point in the pandemic too, at least I know it's true for my husband and I, at first it was very sedentary, trying to get through this. When is this going to end? And now it's kind of like, we don't know when this is going to end. So let's kind of start a routine and let's get back into it and try stuff at home and work out at home with the kids, make it work, try to do something every day just to get something in.
Cooking at home, I think, is a big piece of it. I have a number of patients who've lost weight because they've stopped eating out as much and they're cooking at home and eating healthier. So that's a huge part of it as well.
As long as you're not baking brownies like Jason's house.
That's right.
Which I did just make brownies the other day, so then maybe there's something to brownies. It's good comfort food. So Dr. Coley, give us some more motivation to shed those extra pounds. Just talk about some of the health issues that are related to gaining weight, even if it's just a few pounds.
So even just a few pounds for certain people can cause a lot of adverse health consequences. So the first I talked about is blood pressure. So blood pressure can go up just with as little as 5 pounds of weight gain. And for people who already have hypertension, the control can become worse. So you may need a higher doses of medications or may need the addition of another medication if you've gained weight. Alcohol can also contribute, obviously, to hypertension and resistant hypertension. And the problem with weight gain is that it can then lead to other processes such as sleep apnea, where if you gain weight, you're more likely to have sleep apnea, where your airways start to close off when you're sleeping, you have lack of oxygen. And then sleep apnea can drive more high blood pressure and more weight gain. So you get caught in a little bit of a cycle with some of these adverse consequences. So blood pressure, sleep apnea, glucose intolerance, prediabetes or diabetes are another consequence of weight gain, because when we gain too much weight and we have extra calories that we're taking in with every meal, we have our pancreas working overtime. So the pancreas starts to churn out that insulin as fast as it can to try to keep up with the brownies that you're eating, Jason. And then after a while, it burns out and it's not able to keep up. And that's when you start to progress to diabetes. And again, if you're already a diabetic, your sugar control can get worse if you've gained weight. And then, of course, the cardiovascular risk associated with weight gain. Obesity is an independent risk factor for heart disease, for dying from heart disease, for developing blockages, not just in the heart, but also having strokes, having blockages in the legs, and all of those blood vessels. And then finally, the one that I find the most compelling, especially given the current pandemic, is a recent study that just came out of the Lancet that looked at which factor predicts young people getting into the ICU. So we've all heard about these young people who get very, very sick with COVID-19 and end up in the ICU. And they looked at which factor was the most predictive. And they found that obesity was highly correlated with admissions to the ICU. And the reason for that is manifold. Number one, when you're obese, your immune system is actually suppressed. So those who have obesity have lowered immunity, especially to viruses. They also have high levels of those stress hormones, such as cortisol, and some of the others we've talked about, that can then cause more adverse effects, such as glucose intolerance and diabetes, which can also complicate COVID. And then when you're obese, there's also mechanical problems with your lungs. So if you think about extra weight on your belly, you actually have to work harder to expand your lungs. So respiratory viruses such as COVID-19 can take a stronghold more quickly, and it can be harder to ventilate you if you were sick enough to end up in the intensive care unit. So now more than ever, given the COVID-19 pandemic, obesity is a big piece of it. And studies have shown that if your BMI is greater than 25 and you lose 5 to 10% of your body weight within 12 weeks, you can actually boost your immunity by doing so.
Yeah, so all good reasons, all good motivation. Again, we're talking about how the pandemic has changed our lives from weight gain to our relationships. So let's touch on relationships a little bit. Jason, the pandemic is taking a toll on some of those relationships, family dynamics, with many of us working at home, kids around more, virtual school likely in the future for many. What advice do you have for keeping the peace and dealing with some of the stress?
Yeah, I think it's challenging us all for sure. I think the first thing to keep in mind within your home, space and distance are so important. And it's important to have spaces for different things. So I've got the office here that I work in at home. My wife is a teacher, and so we had to reconfigure a room for her to teach in because she can't teach long-term in our dining room anymore. She needs her own dedicated space. And those, with that dedicated space or the space that you designate, it doesn't have to be a separate room, but routine is also important, so you can shift in and out. And so I think having your space working for your new lifestyle is really important. But also when you're in that new space, having the distance from others. So when I'm at work just as if I was going to the office. A new phenomenon that I've noticed with my 11-year-old, she now requires more distance, and because we're always together, she now goes in her room and shuts the door. And I've had to learn to respect when her door is shut. I don't knock on it, or I might knock on it and peek in every once in a while, but she has that need for her own separate space. And I think we all tend to get along better when we can kind of go off into our own little caves. I think that's important. I think a second thing that you can do is really focus on keeping it fresh within your household. Vacations this year, vacation season is completely different. A lot of people have had to reschedule, and I think we've had to rethink. And so vacation time is whenever we can get away, we can relax, we can reconnect with our family members, we can build relationships that help us cope with the friction that builds up. It's a nice balance. That is still more important than ever. So if you are not planning a vacation, think about what you can do on your weekends. And you really may have to work at it just like you work at work. Really sit down and think and be mindful and plan to do something different. A few weeks ago, we did a little tour in Maryland where I live, and we visited 5 cities that were all within a close distance. And I made a little survey, and my family all rated, we voted on our best town. And it was a fun day. Go do it. Go explore towns that around you that you maybe have never been. It was really a great time. I think the other thing is when you're not up in arms with each other, when you're a little bit more relaxed, talk about what's going on in your household. Talk about when you get grumpy. And, talking about how you are existing and living together, even with young children, is really important so that you can learn from each other. When we're heated, we tend not to be the best communicators, and we certainly aren't the best listeners.
Yeah, I think that's all good advice. We talked about travel last week with Dr. Coley, just kind of into summer travel tips. So I like your idea of staying close, visiting some places nearby safely, getting the kids out of the house and doing something like that is a good idea. But yeah, it also just helps that mental health to get out and do something safely and try to do something different, I guess. Dr. Coley, are there anything you can add, some tips you can add about dealing with some of the stress right now?
Well, I did want to add one thing, which is that research has just come out of Stanford, and some of the experts there are talking about working from home with their work relationships and how it's going to impact the way we interact with our work colleagues. And there was a study out of China that suggested a 13% increase in productivity with working from home. This was done in 2015 before the pandemic. But these researchers at Stanford are saying that it's going to have quite the opposite effect this time, because one of the biggest components of what's different about what's going on right now is that element of choice, because we are not given the choice to work from home. We're being asked to do it. Our kids are around. There's less privacy. So it's actually going to have an adverse effect on our productivity. And the fact that we're not interacting with colleagues regularly at work makes for less innovation, because as you all know, one of the best ways to come up with new ideas is to talk in a group and bounce ideas off of each other. And Zoom is just not the same. So to Jason's point, I think we have to work harder to try to really maintain the integrity of those relationships, whether it's the personal relationships at home or whether it's those professional relationships that we value and that career development that we all value so much. Because as we said, this could now be going on for several months, even a year, possibly even 2 years until the vaccine is there. So I think the first piece of advice would be to just try to, stay at it, not lose your stamina, and try really, really hard to recognize where it is that you need to work hard.
Yeah, it's just working. Yeah, just creating everything differently, new ways to do everything. And we had an all staff meeting yesterday at 9 Health, and our CEO Gary Drews is even saying, can we meet at a park and socially distance and just wave at each other for a second? It does help to see people in person. Zoom doesn't cut it sometimes, but yeah, we're just all working within this new world and these new limits that we have. Jason, we talked to you before about loneliness and the effect on our health. Many people are probably, especially lonely right now, the elderly, people that are high risk and can't leave at their house at all. What can people do to help reduce the negative impact of loneliness on their health?
Yeah, for sure. And keep in mind, you might be surrounded by people and still feel lonely. Loneliness really is about having a connection that is meaningful to you. And so I think that people really are lonely. And we've talked a little bit about stress and anxiety and depression, and certainly being a little anxious or depressed can further lead you to feelings of loneliness and really causing an inability for you to reach out. So I think a few things to do is kind of understand where you sit, understand the impact of stress on your life. As you mentioned, Cigna and 9Health have partnered to put those 2 assessment tools on 9healthfair.org. Go check them out. I did yesterday, I actually took the anxiety assessment, and I'm very anxious. I know that, but it helps to see that there. And so go check that out. Understand if you are dealing with a mild level of depression or anxiety, and then follow some of the tips and guidance from that website. There's a lot of great resources there. The other thing that you can do is go to Cigna.com. At our website, you can scroll down and there is a loneliness tab. And on there, there's lots of resources and suggestions for dealing with loneliness, including the loneliness survey that we used as the basis for our research over the last 2 years on loneliness. And again, go check it out. I suggest, hey, as part of your staff meetings, if you're on a Zoom call, maybe everybody takes the loneliness assessment and you discuss it. Maybe have your family members take it and discuss it. So start talking about it. I think the benefits of the pandemic, the silver linings, one of them is that we are talking about depression and anxiety a little bit more. We are talking about the impact of loneliness and focusing on it. I guess my biggest piece of advice, and I am guilty of this, there are times when for whatever reason I'm feeling lonely, but there's something about me that says, I don't want to pick up the phone. I don't want to make that call. Even if you don't feel like it, it's important. So there's a saying, fake it until you make it. I guarantee if you're feeling that way, reach out, push yourself through the little energy, and you'll probably feel a little bit better afterwards.
Yeah, and Jason mentioned the screenings at 9healthfair.org. Thanks in part to Cigna for helping with those mental health tools, but there's one for depression, one for anxiety. They're anonymous. They only take a few minutes. It's just a short questionnaire, and you can even take it daily just to see where you're at, or a couple times a week just to see where you're at that day, to see if need extra attention to things that day and extra attention to yourself. Dr. Coley, most people are just commenting that they've either lost weight, gained weight. Someone said they're 6 feet from the refrigerator, so that's not helping. Different 6 foot distance, but someone did comment, Barbara, and I want to bring this up. She asked, why are Black people affected more by COVID-19? And I think we touched on this before, but maybe just talking about minority groups hit especially hard, even with mental health issues surrounding COVID-19 as well.
Yeah, there are some reasons. Some are thought to be socioeconomic reasons for the disparities, and others are thought to be physiologic reasons. So socioeconomically, unfortunately, the African American community, the Latino community, they're more likely to be frontline workers, or those essential workers that we talk about, where they really can't work from home, socially distance, maintain, that separation from work and home as common as some of the other racial communities. The other reason is because of their living environment. So a lot of these underrepresented minorities are living in, close quarters or multi-generational families, or many people in the same home, again, with a lot of close contact and inability to maintain some of those distances that are privileges to some of the other members of our community. But there are also some physiologic differences that are thought to attribute to some of the reasons. So hypertension, for example, in Blacks is a different disease than hypertension in some of the other communities. It's more early onset, it's more resistant, it's more genetically mediated. And as we all know, hypertension is one of those risk factors that can make you higher risk for COVID-19. And similarly, in the Latino community, diabetes incidence is very, very high. The diabetes in the Latino community appears to be much earlier onset, can occur during pregnancy, as opposed to diabetes in the Caucasian community that usually occurs when the people are much older and or associated with weight gain. So some of it is physiologic, some of it is socioeconomic, but the bottom line is it's a problem because there is a huge gap when it comes to the outcomes in the Black and the Latino community. And what's been more concerning lately is that we're seeing that MISC, which is multi-system inflammatory syndrome in children, is following the same sort of lines. And the Black and Latino kids, greater than 70% of the cases here in the United States have been Black and Latino children who develop MISC, which is a potentially life-threatening complication of COVID-19.
Yeah, so the COVID-19 pandemic is really just affecting everyone's lives, some more than others, but there's big changes for everyone, and it is just kind of hard to deal with. And as we said before, maybe you're gaining weight, maybe you're having trouble with your relationships, maybe you need to check in on your mental health. And I'm going to let both of these experts go. If you have any questions, you can continue to post those in the comments, and I'll get those answered for you after the fact. Most people, though, are just saying whether they've gained or lost weight. So kudos to those that have lost a healthy amount of weight. And again, 9Health is partnered with Cigna to provide free online mental health screening tools. Go to 9healthfair.org. I put the link in the comments directly to the page, but screen yourself for anxiety, depression. And also right now, if you have gained weight, it's probably good to check in on your baseline of health, get all your numbers. We are finally offering the screenings you'd normally find at a 9Health Fair at Quest Patient Service Centers. You go to 9healthfair.org. I'll post the direct link to this too, but it's your 9Health Discovery Kit. You can build your own kit of screenings, but for $35, you can get your blood chemistry, and that'll give you a good baseline of health. Another $30, you can get an A1C, hemoglobin A1C, which gives you, your baseline for whether or not you're pre-diabetic, diabetic, at risk of becoming either of those things. Plus, we're also offering COVID-19 antibody testing. So if you think you've had COVID-19 in the past, see if you were previously infected with the coronavirus, and if you're positive, you can donate your plasma and potentially help your neighbor, help others. And if you have any other medical questions, or you know someone that doesn't have access to the internet, to these Facebook Lives, they can call our 9Health Neighbors line. It's 303-698-4455, extension 2005. Leave a message, and a 9Health medical volunteer will call you back within less than 24 hours. You can talk to a real person, get some questions answered, any medical question that you have right now. Or if you have questions about any of the screenings that I just mentioned, call with those questions. But I want to thank you both for joining me, and I'm going to let you go. Thanks so much.
Thank you.